our A5 diabetic folder that you will, these are not A5 but they're going to be A5, that will just slot nicely in there. It's in a nice bright, hopeful, cheerful colour, and it says my name is Tracy Higgins, I am diabetic. And then we're going to hopefully design lots of pictures that would depict a toolkit, because a toolkit could mean a different thing to a different person. And a bit like when you go to the dentist, when you get your folder, you can have a choice of these stickies, pictures to put on the front, so it's personalised to you. And we have the NHS logo on there, so it's important because health's important to people. Then on the inside cover we have useful information, so the patient's, your NHS number, your doctor, your optometrist, the retinal screening number, the number for Keighley and Ilkley voluntary services, so you can find out what community and voluntary services you can tap into. And then importantly at the bottom, your diabetic nurse is and a named person, so that individual knows that this named nurse is there to look after them and support them through their condition. Then we have, you've been diagnosed with, and you would fill in type 1 or type 2 diabetes. Generally it would be type 2 diabetes. So they know they've got diabetes. There's no in-betweeny bits. And then we're reinforcing that all the way through by personalising it into the first person. So, and we talk about diabetes throughout. So what diabetes is, the symptoms of diabetes, the treatments for diabetes, the complications, the regular checks you will need for your diabetes, how diabetes can affect your driving. So again, it's reinforcing that message so they're very clear when they leave that they actually have got diabetes. They haven't partially got it, or it's going to go away, they've got it. And then the nurse will, or the person diagnosing will say they've verbally discussed the information relating to all of these key areas, and they've provided written information as well. What we've said is we might need to look at what written information is currently provided and maybe make that a bit more user-friendly by depicting it through pictures if we can. Then there's recording your results. So there's a list of all the results that you would get. So your HB, your cholesterol, your height, your weight, your BMI, your BP, your retinal screening, your eye test. Again, will come under each other so that people know they've got to have both done. And then podiatry or chiropody or foot care, whatever we call it. And then you'd have your target. So what your target cholesterol rate is, what your target BMI is, what your target weight is. And then you'd have all the figures on diagnosis at 3 months, at 6 months, at 9 months, at 12 months. And then you'd start again. But the nurse would make it clear when she's giving this information that depending on how well controlled your diabetes is, you might not need to have checks done every 3 months. Oops. Then we've got your follow-up appointments. So we've got January through to December. All that's depicted on there is that you will need to see your nurse. You will need to have diabetic retinopathy screening. You will need to go to the hospital clinic. You'll need to go see the chiropodist. You'll need your blood and urine test, because at the point that they're at, they won't know what the actual detail of that appointment is, but it will remind them if they've seen the nurse in January that they need to see the nurse again in July. So they just write in that they need to see the nurse in July, and then if they didn't get an appointment through, they could get in touch with the nurse. Then when they actually get their appointments through, they put it into their personalised calendar, which quite simply states, my next appointment for podiatrist is on the time and the place. And at the bottom we'd have useful numbers again, so if they needed to cancel any of these appointments or rearrange them, they don't have to flick to the front cover to find the information, it's there. And it'd also have important dates on like Ramadan, Hajj, Eid, etc. So we could make sure that we try and avoid giving appointments during those religious festivals. We then look at family and community support, so education for both the patient and the family, and talk about the genetic link. So actually, if you can change your diet, your habits, your lifestyle, if you can gain the support of your family, you're not only going to be healthier and control your diabetes better, but you're actually going to make your whole family healthier and reduce their risk of getting diabetes, and then talking about what support there is in the community, so clubs at mosques, notice boards at mosques, maybe cookery classes in the community, exercise classes in the community, community walks, etc. And again, we might have the number of Keighley Voluntary Services on there so that people can get in touch with them to get details of what's available locally. We then move on to the action plan. And basically for the action plan, we liked the one that was shown on the video, and we liked the self-efficacy checklist, but we also liked what the health trainers do in terms of the stepped approach. So we'd use a combination of all those three really. And obviously, clearly throughout all of this is the involvement of the patient. So this would be joint ownership of this in terms of the building that relationships and that respect between the professional and the patient.
Right, so we designed a document which is again A5. We thought a bit about the look and the feel of the document, so we thought similar to the kids' red book, having it sort of a PVC sort of waterproof type document, so it looks like they're gonna, they need to look after it. It looks valuable. Again, we said A5 either horizontal or vertically. Again, having the personal information, name, address, contact numbers for them, for the GP, what type of diabetes they have, the control, the medication, how long they've been diabetic as well. And then key messages, so about the document itself or about the booklet itself, why it's important to record the information in the booklet, why it's important to keep the booklet, and why it's important to see the healthcare professionals as well, so things like the optician, the chiropodist, the diabetic retinal screening, and what we decided was to do a sheet for each individual specialist, so having colour-coded sheets with sort of icons as well, so an optometrist with glasses, the diabetic screening, the camera, the nurse with a blood glucose something, a blood glucose monitor, a GP with a stethoscope, and so on. And then under each heading having a brief explanation why it's important to see that particular healthcare professional. So that's the same thing again. And then the sheets, the individual sheets themselves would be sort of double-sided. So the practitioner name, so something like the diabetic retinal screening, having sort of bullet points as to why they need to see them, how often, when, so sort of the 5 points of what, when, why, how, and then pictures as well as to what that particular person is looking for and how they're there to help them. On the other side of that practitioner sheet, we'd have a log of the date of the diabetic eye screening, have they attended, the result, and date of next appointment. And then we did an individual sheet for each practitioner, so we might need a bit of help from each practitioner to design their particular needs. So an optician, we've designed one for them. A GP, we thought for them, or for the GP probably won't use this, but for the other healthcare professionals like the chiropodist to have a known list of the medication, and that changes over time. The back of the document having contact details, so for the retinal screening for opticians, for chiropodists. What else did we do? Having a calendar as well, where it would be an annual calendar where they would be able to sort of mark in when they need to see the certain healthcare professionals. So, for example, in January to see the optician, and then they're due every March for their retinal screening. They'd sort of mark it in their diary. And we worked out they're not really going to use this calendar sort of all that much. They may use it, mark 7 to 15 or 20 days. So having an annual calendar would be better than having a monthly calendar. The sheets themselves, we sort of copied off one of those project books. They can be quite easily sort of inserted and removed. So if we look at this very, very quickly, so these can be sort of taken out and put in. So having it ring bound and having it something along these lines. So they're all sort of hard wearing, but then you can add sheets and take them off when needed.
Okay, thank you.